My name is Bethany Johnson. Today's date is July 2nd, 2021. Welcome back. Today we'll be discussing the respiratory system. I will be sharing some pre-selected pictures courtesy of Visible Body, and I will also be discussing with you regarding a common disease that can often be contributed to the respiratory system. So we'll get right to it. First, I'm going to be showing you a picture of the primary bronchus. There is a left and a right primary bronchus. The first one I will be showing you is the left primary bronchus, and that is right here. I have dissected the scapula and the ribs out of the back portion of the ribs. As well as some of the vertebrae as well, so you can kind of get more of a close-up. So this is the left primary bronchus. And then we have the right primary bronchus right over here. Right here. So you would have the left would be right here, and then the right is right here. It kind of goes down a little bit. And the right is much smaller than the left as well. This is a picture of the larynx. This blue area right here. Again, I dissected that out so you could see that. And then I have also dissected some of the tracheal rings that actually line the trachea. So there's actually like rings that would cover this, but I dissected this so you could actually see the full trachea. And so this is the trachea that runs all the way down here, in that blue area. Now I will be showing you superior, the middle, and then the inferior areas within the lobe, or within the lungs. This one I have is the right section. This is the right section of the superior lobe, and I have only highlighted a part of this, but it actually runs all the way up here. So it would be all this blue, and it actually runs all the way up to the very top. And then all the way up, right up in here, and then all up in here. So all this really should be blue. This whole section is the superior. And then the middle would be down here, which I have a better picture of that. Just so you can kind of see, because I know what the camera is. So this middle would be right here, and then it would also be this little section here too. So what's really interesting about the right side is it's actually divided into three parts. The superior, this middle section, and then all this down here would be the inferior. And I'll show you a picture of that. So the inferior lobe section would be this blue, and then it also would come all the way up that. So that would be, so superior, middle portion of the lobe, and then the inferior, all on the right side. So divided into three parts. And the left only has two. It only has a superior and an inferior. So the left side would be this portion right here, all the way, it would be this blue, but it comes all the way up and then all the way down. Right in this whole section would be the superior, and then the inferior would be all that down here, which I'll show you a better picture of that inferior portion. So you can see I actually did highlight all of that in this area, all that, and then everything else that's in that pink color would all be that superior portion of the right side of that lobe. The next picture looks like I have the diaphragm. So that is what is underneath the lobes. All that blue section carries down part of that. Put that more in the middle. The root of Hilm on the left side. I have highlighted that, and that is this blue area right here. You can see the aortic arch up there, almost right next to that. And you can see some of the pulmonary veins and the arteries within this picture as well. So the root of Hilm on the right side, again over here. This blue area. You can see part of the heart in this superior vena cava in this picture as well. So now I'm going to be showing you the peritoneal pleura, and this is going to be the outermost portion of the lobes of the pleura, which is a lining. Pleura is a lining, and we have a peritoneal pleura, and then we have a visceral pleura. And the peritoneal pleural is the outermost, and the visceral pleural is underneath the peritoneal, and that lines all the organs, the heart and the lungs as well. But this is the outer portion, and this would be the left peritoneal pleural, and it just lines the outside of the lobe. And then again on the right side, the same thing, right peritoneal pleural. And then the visceral, which I said is right underneath the peritoneal pleural. So I just, to be able to get this left side of the visceral pleural, I just dissected the peritoneal off. So then right underneath was located the visceral pleural. So you can see that on the right or the left side. And then the right visceral pleural again would be over here anatomically right there. So that does it for the pictures. So now I will be discussing a common disease. And the disease that I have chose to discuss is asthma. Just to get started, asthma is actually a long-term condition that affects the airways. And it actually makes the airways narrow, which would be smaller, and it actually causes it to swell. So the airways narrow, but it causes swelling around that area, and so it actually causes extra mucus into the airway. As you can imagine and think, this would definitely make breathing very difficult for somebody that would have asthma, and actually triggers like a wheezing, which almost sounds like a kind of sound when you would breathe out or exhale. It also causes shortness of breath, or within the medical field we call that SOB, which is just an acronym for shortness of breath. Health professionals actually don't really know what actually causes asthma, but it can be genetic. You can get that from your parents, even sometimes passed from a grandparent that might suffer with asthma, and also environmental factors can play a big role. One of the things that I learned actually doing some research on this topic is that if you live in cities or other areas, just for instance, California, if you live in LA, they have all that smog and other environmental issues with all kinds of environmental factors and influencing the air. If you're breathing that in, that can also be environmental factors. So people that probably suffer probably should move out of the cities and maybe move more countryside or into more of a remote area where there's not going to be a lot of gases and other things like that, more pollution. So that can definitely, that's what I mean by environmental factors. Actually, asthma is really common in childhood, but you can actually develop asthma at any point in your life. And really interesting fact that I learned doing research on this topic is actually it is not uncommon for people over the age of 50 years old to be diagnosed with this lung disease. So really any time in your life you could be diagnosed. even though a lot of times people think that you've always had it since childhood. That's not always the truth. Some of the signs and symptoms of asthma are, like I said prior, shortness of breath, like we say, SOB, chest tightness or pain, which would be angina, that we call pain in the medical field, wheezing, again, upon exhaling. Also, wheezing can be exacerbated or worse, which would be worsened with any type of respiratory virus, whether it be just a simple cold or influenza, or definitely now with the coronavirus, a lot of people are having more comorbidities or exacerbations of their comorbidities, which asthma being one of them, if they were to get COVID-19. So definitely that is a huge thing that's happening right now, is people that already have respiratory illnesses, and when they contract a virus, or even right now, like I said, with the COVID-19, can definitely be more at risk for more long-term issues. Severe asthma attacks can actually be life-threatening. During the attack, actually what happens is that the smooth muscles of the bronchi contract. Like I said, they contract, which causes the bronchi to narrow, which we call bronchoconstriction in the medical field. The tissues that actually line the airway, they are actually called pseudostratified columnar epithelial tissue. A long word. And those actually swell, which inflammation of those epithelial tissues, and it causes the inflammation to swell, or the inflammation swells, and it forces mucus secretions into the airway. So that's why it's so hard for people with asthma to be able to catch their breath, even just going for a run, because those pseudostratified columnar epithelial tissues swell, and then that forces the plunge of mucus secretions into the airways. So that's why it's really good for them to have an inhaler, which I will now talk about the treatment. So the treatment would just consist of quick relief treatments. Inhalers would be the bronchodilators, because we're wanting to open up that bronchoconstriction. So we're going to use a bronchodilator to dilate those airways that are going to actually quickly open up that swollen, that inflamed airway that is actually limiting the capacity of the person actually being able to breathe. And then also long-term medication such as inhaled corticosteroids, which are actually the most important medications used to be able to keep that asthma at bay and under control. These preventative medications, they're going to just treat the airway and the inflammation that actually leads to the asthma symptoms. Since there is actually no cure for that, we're not going to make the asthma go away, but again, we're going to take the preventative measures with using our long-term corticosteroids, and then also if you were to have an asthma attack, or just to keep that more PRN for the bronchodilators, which would just be PRN is on an as-needed basis. To use on a daily basis, we want to make sure that these medications are used and can significantly reduce or eliminate the asthma flare-ups altogether. So making sure, the simple things, making sure that you're in a well-ventilated area, you're not living in a pollutioned area, and you're able to keep those medications on hand, take them daily, and exercise is always good to help open up those airways, but not over-exercising, because sometimes that can exacerbate issues as well. But just nice light walking and keeping that airway open. And staying healthy, number one, because we want to limit as many viruses as possible to not exacerbate the asthma at all. So thank you very much for watching. Have a great day.